Hello, my name is Dr. Jacqueline Bourgeois. I'm the lab director and the chief of pathology here at Cambridge Memorial Hospital. Today, I'm delighted to introduce you to the lab and all of the staff that care for our patients here. We're quite lucky that the lab is quite close to the front entrance, and we'll start off with our outpatient lab. Once we get down this hall, we're quite close to the core lab. This is the core, where most of the specimens come in. This is where everything starts, and I'm happy to introduce those that actually help with the specimen journey.
We come to work, we start at 6 a.m. and we come in and we get what's called our blood collection carts ready. And once we're ready, we head up to our floors and all the units, and we collect all the blood that has been ordered on all the patients that day, which includes our emergency department, which is where we do our one-on-one face-to-face with all of our patients, which is what we love to do. After all of our collections are complete on each floor, we put all of our samples into a bag and we put it in what's called a bullet, and then we send it through what's called our pneumatic tube system, which is in every department, 1 or 2, and we have 2 in the lab to receive all of our specimens to be processed, received, and separated into each department in our lab. That's when our technologists will then take our samples, put them on the analyzers, and then they will review, release all the results.
Hello everyone, my name is Nav. I'm charge technologist in transfusion medicine. Welcome to the department. Here in our lab, we perform testing, safe testing for preparation and delivery of right blood product to the right patient at the right time. We have our automated analyzer in TM, which helps us to perform all the essential testing required for preparing blood required for transfusion of patients. We have plasma freezers, which are maintained at ultra low temperatures to preserve plasma, which can be thawed when needed in case of patients who come in with trauma, critical care, or surgeries. We also have medical grade blood refrigerators where we store our blood and other red cells and other blood products, which can be readily available for patients when they need urgent transfusions for life-saving requirements.
Hi, my name is Sajjad. In hematology, we study blood disorders. We get the CBC test. We run on our automated analyzers. If the report is normal, it goes automatically back to the physician, ordering physician. But if it's abnormal, we make a slide and we look under the microscope. If we find there are abnormalities, we take it to our pathologist to get diagnosed for different type of blood disorders like different types of anemias, leukemias, and lymphomas. We process around 5,000 to 6,000 CBCs per month, and we give our CBC results back to the ordering physician within 20 minutes.
Hello, and welcome to CMH's chemistry department. My name's Joe Finlater. I'm the charge MLT, and I'd like to show you some of the equipment we use here. Our main pieces of equipment are our blood gas analyzers, the GEM Premier 5000s, the Iris Cell, which handles the urinalysis for us, and our main workhorses, the Vitros XT 7600s. Excitingly, we're also the first site in North America to be using the Quidel Ortho Result Manager. This is a piece of middleware software that we are hoping will allow us to increase efficiency within the chemistry department. Our hope is that through getting results back to physicians and nurses faster, we are going to be able to increase or improve patient outcomes as well as patient satisfaction.
Welcome to the grossing room at CMH, which is where we examine everything removed from the body, ranging from small diagnostic biopsies all the way to whole organ resections. Our new ergonomic and ventilated workstations allow us to efficiently and safely examine over 12,000 specimens per year. We are in the process of implementing integrated high-tech camera software directly into our workstations so that we can utilize high-resolution photography to assist the pathologist in making the patient's diagnosis. Once the tissue is finished being examined here, it is then processed and stained and then sent for histology.
Once the tissues are processed overnight, the material is actually brought into this part of the lab where those small pieces of tissues are actually put into blocks in order for the H&E sections to be produced. This is occupied first thing in the morning for several hours, and then once the tissue is embedded, our lab technologists are able to cut and produce the small glass slides that we get in order to make our diagnosis. So the most common stain we use is a hematoxin and eosin. That stain is 150 years old, so pretty old technology. Having said that, that's the mainstay of making our initial diagnosis and identifying things like cancer. Once we've done that, there are, however, lots of modern changes in pathology, including immunohistochemistry right on the glass slide tissue. And these two pieces of equipment help us actually do that. You need basically two. Just in case one goes down, we always have a second. But the volume of cases in our hospital at this point, we often are using both at the same time. And then at the end of it, all of our technologists will check that the slides match the requisitions that we started off with when the specimen came in, and they will actually bring them down to each one of the pathologists. The lab technologists will bring the cases to me, and I'll sit down and look at them, work on the Meditech, provide a diagnosis, and at the end of the day, we'll sign out cases if they are ready for release. All the equipment here has been put us in a great position to be future ready. I want to thank the donors for providing us the funds in order to maintain most modern technology that we can be using.